Noises of people eating.
Yeah, it doesn't matter at all. Sorry. Give us to you first.
My name is Jessica Jacobs and I am a first year student now studying at London South Bank University.
My name is Holly McMorrow and I'm a first year student now studying at London South Bank University.
My name is Charlotte Tongson and I am a first year student now studying at London South Bank University.
My name is Lisa and I'm a first year student nurse studying at London South Bank University.
My name is Bonnie Sawyer and I am a first year student nurse studying at London South Bank University.
My name is Gemma Anderson and I am a first year student now studying at London South Bank University.
My name is Georgia Simmons and I am a first year student nurse studying at London South Bank University.
My name is Dovila Stankuta and I'm a first year student nurse studying at London South Bank University.
My name is Nadia Silcock and I'm a first year student nurse studying at London South Bank University.
Brilliant, thank you very much. I know that seemed a bit strange. There we go. Okay, the first thing really is to ask, what motivated you to apply to do children's nursing?
Should I go first? I have a younger cousin, he's 5 now, and he was diagnosed with Down syndrome when he was born. So he had open heart surgery when he was only like a week old. So he was a baby, tiny, and I was just interested from then. So that's what was my main inspiration.
Brilliant. Might not be
I've been around children. I have been babysitting since I was probably 14. So for the bigger part of my life, and I just love children and I love biology and medicine. So I thought I would combine the two, which works out quite well, I think.
I think that's the same as me. I really enjoy science but I also really love children, so it's all, yeah.
I originally wanted to be a doctor, but then when I didn't get the grades I realised that it wasn't actually what I wanted to do and I wanted the more sort of caring side and actual real patient interaction.
Social side of it almost.
Yeah, exactly.
I started doing a biology degree and did the first year and decided to leave within months at the start. But I finished the year off and I decided that I wanted to do more things to do with humans, but more social and interaction-y with people. And I kind of wanted to do midwifery at that point. And then I started a job where I was a home care support worker, so like working with only 3 children within their own homes, doing night shifts and evening shifts, just basically almost being a part of their family for like ages. And that kind of gave me that kind of in-depth kind of experience with children, and it was quite nice. And they had certain healthcare needs that I was kind of interested in, and I looked them up, and that kind of got me into children's nursing, really.
Mine's similar. I've been working probably for like 6 years with special needs children, and then with different needs and stuff, and it seemed like more of a career as opposed to being like a support worker forever. It's like you can progress and take different pathways.
You almost realise that you can do a lot more with it than just like
It's
looking
like
after
there's
them, doing
different routes,
this,
isn't there? Whereas it was like I was doing the same job and there wasn't really any progression. It was just going to be that forever.
I've just always wanted to do children nursing, and then since I had a baby it made me want to do children nursing even more.
I'm the same as that. I did childcare, so I didn't want to do A-levels to get there, but when I always wanted to be a nurse. I didn't know a children's nurse, but I knew I wanted to be a nurse. And then when I was at college, we went on a trip around the children's ward, and it just, from then on, I knew that was exactly what I wanted to do.
I've been volunteering with Central Ambulance for like 14 years now, and I really enjoy the physical side and like the emotion you get from helping people. So to have that as my everyday job would be what I want to do.
Wow, that's brilliant. So there's a real massive mix of, isn't it really? Yeah, but it all comes down to everyone caring. So wanting to sort of care and things. That's brilliant. So, my second sort of thing was, what experience of working with children have you got? But you've said that. So some of you have got real sort of strong experiences. Some of different sorts of things. So what do you understand to be play then? What is play?
I done a level 3 in childcare and education, same as Georgia, and you sort of touch upon it in your assignments at play, because quite a lot of the curriculum for young children especially is sort of focused on play to help with their development.
There's loads of different types of play.
Yeah.
Like
Structured play
therapeutic and imagination and
Free flow.
yeah.
You can use play, I suppose, to like distract and things as well. So like that kind of like when I was working with the kids that I was working with, there was some twins and an older sister, and sometimes the older sister would get jealous of the younger brothers getting most of the attention and stuff. And even though I was there for one of the boys, I'd kind of distract them. I didn't know I was like doing it or anything, but I'd distract her with some drawing over here or something, like just to like diffuse the situation almost, like that kind of thing. That's quite useful.
Yeah, to like help with behaviour.
Yeah, you don't even think about it though, and then you come and listen to like lecturers saying about distracting them so that they don't moan about being hungry before an operation or something. You realise, oh, actually, stimulating. You don't actually even like realise you're doing it.
Like plays the only way they can learn. They can't really learn through like book learning or they're not really. Although there's learned behaviour, it plays the majority.
Yeah. You have to do the plain learning before you can do the other learning almost. Yeah.
I like take my nephew to the park and they've got the alphabet on the floor and we do like who can jump the furthest and it was just turned 4, and so then we do like what letter did you land on and like learn the letters by playing the game kind of thing.
Helps develop their milestones in certain levels, because all children are different. So some children learn quicker than others.
You could use play to distract from pain as well. And you like motor skills and stuff, just picking things up. If they don't have the opportunity to pick things up, they don't get the fine motor skills that they need to be able to like use a knife and fork, for example, like things like that.
I done volunteering at a special needs charity that supported children and their families, and you have like the curriculum where it says, well, it's not really a curriculum, but where it says at this age they should be able to do this. But at this charity they had a different version where it didn't have the ages, so they would put the play in that would link to the milestone, if that makes sense. So it makes the parent doesn't feel like their child isn't a normal child, so to speak.
That links in with like kids who have like disabilities and things, and they're not as progressed as some children, and they have like, it's called like ABC, like that kind of thing. Like, so it's not age specific, it's more levels specific, so you don't feel that it's wrong or something like that.
I did work experience in a like primary school, and it was like half period with a school for the deaf, and like young children like 4 or 5, they like obviously they can't learn like sign language and stuff. It was really difficult for them, especially the children who didn't have problems with their hearing, and they were all integrated together. So like we would help them play with each other, and it was how they like communicated with each other and how they got on and stuff.
Yeah, the play is almost like that level that they can relate to each other on. Yeah.
Well, I did find when I did part for my course was a year in a nursery, but some of that I was in reception and year 1, and the jump from reception to year 1 is a big difference. Like they're sort of almost chucked in at the deep end, where they're not eased in with play. Like nursery reception, you're just playing most of the time, and then year 1 is just sitting down and in front of a teacher with a pen and a paper.
That's really good, that's brilliant. You put on some really good different areas. Really excellent. Anybody got any experience of children playing in hospital then? Because a few of you mentioned sort of pain and distraction and things. Yeah.
Do you want to do this?
I worked in a teenage mental health ward, and play in itself and board games and chess and art therapy was a massive part of our daily routine. So at first you would get a bit of an attitude, oh, you know, playing is for kids, but then they would get really drawn into it and would get quite competitive sometimes. It was one of the ways for a multidisciplinary team to get closer and to get the children to open up. Some children would completely shun any help, and the only means of getting closer to them and being able to understand them was through play or through art therapy, drawing, and you know, using plasticine to shape up figurines and then sort of try and explain how these reflect the moods or the fears. So I found that fascinating. I didn't really, before I started working there, I didn't really understand how helpful it can be as a tool. You know.
What age was that?
That was 12 to 18, but we would rarely have kids above age of 16. So probably 13 to 16 was the age group of ours.
That's quite an old age group, isn't it?
And sometimes if we would have somebody with learning difficulties or learning disabilities, play was the only means of communication, you know, showing pictures, showing diagrams that they could understand and read, to put that person at ease and to actually, you know, settle them in the environment.
I only managed to get a 3-day work experience on a children's ward in Warwick, and I was a bit gutted that it was only 3 days, but actually when I was there, the amount of play that goes on, because it's all about distraction, is a big one, but also there was a child that they thought might need to have hearing aids, and they brought a doll in that actually has got a hearing aid, and it was like a way of helping the child understand that it's not just them that has this, and they use like dolls to help, like dolls with bandages on, to make it out as if they've got like all the same problems as them, so that they sort of understood that it wasn't just them, and they helped like bandage the doll or do whatever with this doll to sort of understand that they need to do the same to get better. Or
You get books about that as well, don't they? You get books that you read with the children that like kind of gets them used to the idea of it, and it makes them almost like, even from a very young age, if you have these things in their life, it means that they don't think that it's abnormal or anything like that, and like it's a normal thing for them, so it's just, that's okay, like it doesn't make any difference.
Was anybody was in hospital as a child themselves?
Yeah.
Do you know, can remember what you did? Or
I had a cannula in my hand and then started playing basketball. That's all I can remember. Really.
Played basketball?
Yeah, in the little room. I kind of dislodged it a little bit, but yeah, I don't think that's the kind of play they want me to do in there.
My sister, when she was about 3, it was nothing major. She had a really big splinter in her toe at the bottom of her foot, because walking around with no shoes on in the garden, and she had to have so much anaesthetic because they had to pull it out. She wouldn't let them pull it out being awake, so in the end she had to have an adult's dose, but they give her a bear that she's still got now, which she calls Red Ted, and although it's not play, it's still like that sort of like comfort object that actually helped her with her experience or in the hospital. Yeah.
I had an opposite experience when I was in hospital, because I was only in for like a day surgery, and I was probably like 6, and the nurses didn't speak to me. They spoke to my mum the whole time. They never told me that it was going to be okay or anything. And when they took me into the room, my mum was quite upset. It was only like really minor, but my mum was really upset, so they recommended that she didn't come in with me to put me to sleep. And I was absolutely terrified. Like, I was crying for my mum. They didn't let me have anything. Like, they didn't speak to me, they didn't give me anything to distract me or like help me understand why I was in there. And so I think play is
I had the same experience. I was a bit older. I think I was like 13, and I was going in for it was a day surgery as well. And like they didn't even come near me. Like they were really like kind of patronising. And because I was on the older side as well, they didn't think that I kind of needed it. They thought like, oh, she'll be fine. But like I was still pretty young. Like, I didn't know what was happening or really what was gonna go on when I was in there. And I think like I could have used like some interaction or anything.
Yeah.
I'm just quite happy because I'm quite old, like 29. When I was a kid, that was 20 years back. Well, 20 years back when you sort of say that. I was quite ill. I had a spell of really bad health when I was little, so I was in and out of hospitals for the best part of 2 years. And I remember, they didn't have playrooms. They had tiny kids' library on the wall where you could get books and read them. And I remember feeling extremely lonely. There were a few toys available, but nurses, as kind and as nice as they were occupied with tasks of actually caring, and they didn't have that time to interact with you, and there were no support workers like there are these days. So I just remember feeling really lonely and using all the opportunities I had to use the nurse phone and call my parents. That must have been heartbreaking for them, me sobbing in the phone and saying I want to go home every day. And I was put in the same room with the older girls, so they were they were 14, 15, and they were talking about boys and completely different things that I had no interest in at that time, and they looked after me. They were nice, but I still felt extremely lonely then. And it's just nice to see how that has all changed now, and how much more opportunities there are and facilities there are.
This wasn't a personal experience, but when I was in hospital, there was 3 or 4 people in the same room as me. I think there was like 6 beds, but a couple of them didn't have people in them. And there was this one child, I remember, that was pretty much alone all day, and the nurses would come in and check on them, but it'd be like 5 seconds, it wouldn't be a lot of time. And I think at one point they went into the playroom and came back with a little book, and they just sat with this book for like a good couple of hours and stuff like that. So I think it has improved, and this was like probably 13 years ago, something like that, but it has improved, and you see children being played with, or you hear it talked about more in just general like media and news and things like that. So it's a lot better now, I think.
And I think it's just children nurses that play though, not doctors and things.
Oh yeah.
And I took my son had to have like an operation in his hand, and he had to have that, to put him to sleep, the mask. And they made me go in there with him, but they just like shoved it on. They didn't care. They didn't play with him, anything. So it makes me cry.
Yeah.
It's horrible.
And that's why you're all here, to make a difference, isn't it?
Yeah.
To make sure that doesn't happen. To really have
I think that's one of the reasons that I think that quite a lot of people, they see things and they hear things that they don't like, and that's why they do think, oh, actually, I want to make a difference to that.
Yeah.
That is a big thing, I think, for me anyway.
That's really good. I'll try not to say stuff because I want to tell you things and I can't. I'm not supposed to. Sorry, because I'm sort of influenced what you want to say, so I'll stay quiet. So do you see play as being a part of the nurse's role then? Do you think nurses should play with the patients? Or
No, I think everybody.
Everybody?
Yeah, like doctors. Doctors just don't care really. They just come in, see you, diagnose you, and then they're off. It's not really bothered. I think it should be promoted throughout like the whole healthcare team really.
Like in the training kind of thing.
I think though, generally, if you're with children, it's like,
You
surely,
automatically do.
you automatically change the way you
It's how
act.
you interact with them.
Yeah.
It's just natural.
I think it was something that was said that like the nurses were too busy doing like actual care, and I don't agree that play isn't a part of caring for children. I think it's such a huge part of like making them better, because if they're stressed and scared and they won't let you treat them because they're not, like, they don't know what's going on, then you're never going to be able to get them better.
I think kids are like, they're meant to play almost, they're meant to be able to do that. So even if they're ill, they should do that if they can. Like, people should encourage them to, because that's what they are meant to do to develop and stuff.
I think because we're going to see children with like safeguarding issues who probably have never played before, who don't know how to play, but we should be able to just to be able to teach them and not have to be rushing around. Be able to like interact with them a bit.
It's hard as well because you hear so many stories about like parents not doing specific things to like promote their learning and things, and if they come into hospital for a week or two, it's quite nice that they do get that little bit of extra play with everyone there.
Or the opposite, if they are used to playing all the time at home and they come in and all of a sudden
Completely
don't
different,
do nothing, like, be a big difference.
It kind of helps the kid as well as you, because like obviously it gains trust with the child, and that if they say come out of surgery and they're not playing, then it probably shows that they're suffering with pain, or they don't feel
You
very
can use
well.
it as like an indicator
Yeah,
of
so
what
it
their
has
mood's
more
like.
observations. But yeah, and then it helps them.
If they're playing as well,
That's fine.
it probably helps the parents as well, because if they see their child playing like they do at home, they're going to feel more at ease. But if they see them just lying in a hospital bed struggling, then it's going to cause them more pain. It's going
And there might be times where like parents might not be able to visit one day, or
to
periods in the day where they're not with parents and they're just sat there on their own and just not really,
Yeah, the nurse is
Very-
supposed to be like
yeah.
a second parent.
yeah.
So
I understand where you are coming from, but in a way, how it worked on the mental health ward that I thought worked quite well was every single nurse was really nice and interactive, but you know, they are higher trained than the support workers. So it was a lot down to the support workers. If they were struggling to engage a certain person, then you know, nurses as the primary care team member would try and sort of give them a nudge towards it. But it was, you know, because nurses are really, really busy, there was sort of, you know, mutual sort of understanding that the support workers would take over with that. And thinking about cuts in the NHS and how busy nurses are, I think maybe, you know, dedicating a lot of time playing. I'm not saying it's not important, obviously you have to be playful and engage with a patient. Maybe it's not the best use of resources sometimes.
Someone's using it appropriately, there needs to be like that. It's all well and saying like, oh, play's really, really good,
Yeah,
you should do it all the time
yeah.
and stuff, but it's using it at the right moment to get
Mm.
things done if you need
Yeah.
to. Like if a nurse is trying to give some medication, you might need to play with them for 5-10
Yeah,
minutes
yeah.
to get them to have the medication. But if the parents are there, they can take that over
Yeah.
and do that job almost.
So
Or the
when-
kids can play together if they're all in a ward together, that kind of thing.
I feel like play as well with children, it's a way to get their barriers down. It's like when you have a child who's really shy, just a little, like, I guess, young children, a little thing like doing peekaboo, a child that won't talk to you will then be like gravitated towards you. And if you're the nurse, I imagine that would then mean that you can sort of do your job and incorporate their like little bits during the day.
Like you said, it almost depends on like the age of the kid as well. Like, you have to
Yeah.
kind of gauge what
Yeah.
they're going to do, because if you just start playing peekaboo with like a 12-year-old,
Yeah.
it's not going to really work. You might just laugh at you and walk away. But
I think age is really important because teenagers are still considered as kids, but you know, when you become really friendly with them, kind of the boundaries get blurred, and they sometimes unwillingly disclose you information that they would not necessarily should, and you have to follow the protocol and say, look, I'm really sorry, but I will have to report that, you know, safeguarding and they lose the trust in you. They go, oh, I trusted you, you were my mate, you know. And it's sort of quite a thin line between engaging them and being there for them to support them, and them developing attachments that are not necessarily appropriate to you. So I think our staff in the hospital would get sort of extensive training on that, and regular reflection sessions, how to distance yourself from, you know,
From certain
yeah. I think with the small kids, it's not so. What's the word? There wouldn't be a lot of that need, but if it's support for teenagers, obviously the activity should be, and the interaction should be slightly different. And what I heard from our teenagers is that they wanted that distinction. Doctor, the consultant, you know, was sort of nearly a fatherly figure for them. So, you know, they would have weekly meetings with the consultant, and they sort of appreciated that distance with him, from him, whereas nurses kind of became like a bit of a surrogate family member in a way, you know. So the duality of people who looked after them and cared was quite, you know, quite an interesting dynamic, I think.
For teenagers, you kind of got that they're looking outside of their family unit for things, and if you give them that with play or with conversation or whatever, they can attach to that quite easily, whereas younger children, they've got the attachments to their parents and to like their brothers and sisters and stuff, so they're not as easily attached that much, I think.
Yeah.
Well, they are easily attached, but they've got the other attachment that can just take over from it, so it's fine. But play, definitely, you need to do it at the right times and things like that, I think.
It has to be very sort of age conscious, I think, and the staff who are working with older groups would get some sort of a mentorship how to go about it, I think, especially with somebody who has got safeguarding issues, or like our children, very often they would not have a fatherly figure or a mother figure in their life, so they would be craving that type of model, and they would make the response very quickly and quite inappropriately quickly, or you would find ones who would be really standoffish and just completely refuse to engage. So, you know, both extremes are not ideal, and it takes a lot of skills to actually find the middle grounds for that and help them out.
I think initially you look at a child's age, but you can have one child in this bed that is 11 and one child in this bed that is 11, but until you get to know their personality, like this child might love to do painting, but this child is like more or less a 16-year-old in their personality. So I think it's important that you have to understand them and not just look at how old they are.
Individual.
Yeah.
So what do you think, so that was the qualified staff, the nurse's role, what do you think your role as a student is going to be? Is it going to be different, do you think, or?
Not in terms of play or care, I don't think. Obviously we can't do all the medications and we've not got quite that responsibility, but I think in terms of care we've almost got, it's as much our responsibility as it is anybody else's to go around and check children are okay and interact with them, and maybe as student nurses we've got that little bit extra time than a normal qualified nurse would have to go around and play with a child or get to know a child. Or
they were saying to us though, make the most of your time, like in your first year and stuff, before you learn all this stuff, make the most of the time you've got to spend playing with the children and stuff, because obviously once you learn more, that time becomes smaller.
They were saying like in your first year it's mostly about like learning how to communicate and like make connections with your patients and stuff. So I'd say like I agree with like what you were saying, like it's almost as well you're a student nurse rather than a qualified nurse, you almost have more of kind of caring side of it because you have time to spend on it.
I think being a student anyway though, it's sort of maybe not expected, but my expectations of being a student nurse, I would have more, like you've said, more time on your hands to play, whereas the qualified nurse has more responsibilities. So I see that as one of the expectations of me, if that makes sense. Because I know as a student doing my level 3, childcare and education, I had more time to spend playing with the children than the teacher did. So it's sort of similar in that respect.
yeah, I was the same.
Yeah.
I did a placement at a nursery that I later got a job at, And the difference between being a student and an actual qualified
Mm.
member of staff is so different, because as a student, you're not counted in numbers, you're not expected really to do what the members of staff do.
Humans don't have a job description.
Yeah, you just go in there and you do, like some students will just tick off what they need to tick off of their list,
Yeah.
and some will go like throw themselves in and be really enthusiastic. So as a student, I think
I think first year
You know,
student
the role to
definitely
play.
don't, yeah. I suppose if you get higher in second and third year, you kind of got a bit more responsibility.
yeah.
Well done, you are.
I think from patients' perspective, they will probably expect more from us play-wise than they would from nurses, you know, and that's only fair. And I think with the older children, they will use that well to their advantage, you know, they will know that you have time and they will go, you know, do this for me, do that for me. They do. It's lovely, I don't mind it at all, but I think that expectation is very much there.
That's really good. I'm really, really impressed. So as a student nurse then, what sort of play do you think are you going to actually do on placement with your patients?
Therapeutic. So if they're going through like a major health scare, even if it's just like a general short illness or long illness, children need like to express their feelings. So things like Play-Doh and things like that, where if they're angry they can take it out on like a malleable material, or painting, or expressive play, maybe.
If the nurse has to give an injection to the child, you could probably distract them with playing whilst the nurse is doing that.
I think it would be really important to meet with a play specialist when we go to our placements, just to like get more of an idea in a professional way of how to play and stuff. Because like I know that like I don't think anyone's like perfect at doing anything, especially like to begin with. Like you need to have that kind of directional kind of thing. So it's kind of like you can play with your child, like do anything and stuff, but to have like a goal to the end, to have a goal of it, it's quite different, I think. So maybe
Like more subjective.
yeah.
Yeah.
Depends on the ward as well, you know, it will be quite different sorts of play. Say, if it's a ward with children who have got breathing difficulties, obviously, you know, the physical activity will be kept to a minimum. If it's a trauma ward, then, you know, activities will be altogether different from, you know, so that I think very much depends on how severe the illness is and what the conditions are, and also very much will depend on the individual, you know, is it the first time round in the hospital, or have they been in and out all the time, and it's like their second home there. Some children, like my nephew, he really likes to read, and he reads happy books when he's happy, and when he gets upset with you, he just ignores you and reads his book, and just, you know, you can't get his attention. That's all he does. He punishes you by reading a book, you know. So it will very much depend on individual people.
I'd say also trying to get, if you're like in a playroom, trying to get the children to play together, so they don't always have to rely on having an adult around, that they might then get to know each other and have sort of buddies on their ward.
Also, it gives them a kind of reference point almost, doesn't it? Like they can kind of, it's someone else of the same kind of age, same kind of illness, that they kind of have like something in common with almost.
Yeah.
And they can play the same kind of things.
shorthand. Well, I was going to ask next, do you think this is going to be different once you're going to be qualified? Or kind of, we sort of said that already, haven't we? But do you think, we'll not put words in your mouths.
I think it will be different. We'll have more tasks to do and we'll be more stressed because we've just qualified and we have to take charge of certain things. I think we might be more enthusiastic. I think some of the lecturers said recently we'll be more enthusiastic than the third years because the third years are worried about having to go off and actually become an actual nurse, a registered nurse. So I think when you qualify, you're more stressed, but then you're more enthusiastic about certain things. It depends, I suppose, where you're specialised, what you're specialising as.
And I'd hope for myself, being newly qualified and understanding how important play is, that is something on my to-do list.
Yeah.
Because it's fresh in my mind, if that makes sense.
I think everyone will have expectations about what they're expecting to find in the ward and what it's going to be like, and it's obviously nothing's going to be exactly how you imagined it. And I think opinions will change over what you thought it was going to be, but it might be better, it might be worse. So
Yeah.
just gonna you need to actually get there and start doing it before you know what it's going to be.
It would definitely feel different once you're qualified though on a ward than when you are a student, because as a student you're not responsible, well you are responsible but you're not as responsible, it's more your mentor, you've got people to go to as a student, and then as soon as you're qualified you've just got yourself pretty much really.
People start coming to you for help.
Yeah, and even though you know the stuff in it, you know everything that you've learned, it's just a bit scary, a bit daunting. It's very different, I think, to be qualified than it is to be a student.
I think with nursing as well, it's one of those things that you can have the skill of it, but it's a lifelong skill. But you're going to carry on learning. Every day you meet a new child that you're going to be looking after, and every time they kind of stump you completely in what they're doing or anything like that, you carry on learning and you change your views and how you approach situations because you've got that new little bit of knowledge and reading up on things and researching things that you find interesting. I think that's very different. And as a registered nurse, you kind of have a different viewpoint. I think you'd have a different
more confident.
Yeah, or you kind of know how to do it, and we're right at the start now and we're saying all these things, but over the next couple of years we'll do loads more assignments and we'll do loads more exams and go in loads of different places and meet loads of different people that will change our views slowly.
I think the enthusiasm will wear off a little bit, because when you start off you're always so enthusiastic and you think you can change the world and do this and that, and it's that's how you have to set out, otherwise you would be doing it for the wrong reasons. But I think the reality creeps in, and then you really have to prioritize.
Also though, when we're qualified, it's over the years, so now we'll go in but we might play with the children but we might not actually be doing the right thing. So over the years we'll experience and see other see nurses and how they get the children to do things and the different ways they play. So it's when we're qualified we'll have a few years experience of seeing and
talking to play specialists and learning from them.
Yeah. So it's we might, be more productive in our play maybe.
More efficient in how we do it to get to an end goal.
Yeah, I feel I would go in now and be yeah, I'm playing, this is really good, but actually it might not end in the, what I actually want them to do, it might not, it might not work, kind of thing. That makes sense.
You might try and distract them and just make it worse. That's one of the things I'm scared about, I think, just making everything 100 times worse.
It's when you play with children in there and they cry, you're oh,
or you start laughing, not at them, but just what they're doing, and they get annoyed at you, and you're oh gosh.
So the final thing, so what do you think you need to be taught then within the nursing course to enable you to play with children?
I think definitely developmental stepstones. We would have to quite not very in depth, because obviously you have got specialist nurses for that, but learning difficulties and learning disabilities and say Asperger's and autism, because it's just really helpful to know how to communicate with children like that they would normally have picture aids, you know, how to make it as stress-free for them as possible. So I think we should definitely be taught on these things.
Almost have like a basic knowledge of the different things that could mean you have to change the way you're playing with someone. Yeah.
I went to a hospital. I do care work for a girl. She's 16 and she's got autism. And I went for her pre-op. Her mum was not there, and the nurse was terrible. Like, she was trying to talk to her, and she was just sitting there like, and I don't know. The nurse had no. She just talked to me and kind of was looking at her like, is she okay? I was like, she's laughing, she's fine. And she just had no, there was like no sort of, it's like she had no understanding of what she could do to try and communicate with her.
Well, like, for me it was interesting with teenagers that had OCD, do you kind of go along with it, you know, or are you making it worse, sort of feeding into that? It's sort of, you know, so before I actually had to ask myself and say, you know, if I need to talk with him, do I actually help him and sort of feed into it, whatever task he's doing, you know, organizing things in piles or whatever, or do I try and distract him? If I distract him, he might get angry, you know, so how do you go about things like that? And I think everyone should have every place, because even though it's a general ward, you will get kids with developmental difficulties or psychological problems, should have at least an overview of each condition and where you could go back and read as a reference.
One of the girls I looked after, she had really severe brain damage, and if you didn't know her, like the first few months I looked after her, I didn't realise when she was smiling and when she was kind of happy and things like that. And then as soon as you kind of get to know her, you're like, oh, actually, like, and that's, you can like gauge their reactions and gauge their emotions and stuff. Whereas if you just came in and it was just a nurse, like you said, like just trying to talk to her or something, they just have no clue because they don't know them.
Yeah,
but then you can't expect them to know them, but you kind of want them to have almost a basic knowledge of how to interact with them. Or to realise they're not interacting in the right way and to change the way that they're doing it almost.
Yeah.
I think that should play should be almost sort of taught, sort of types of play and age appropriate play and things like that, but I don't think it can really be taught because until you go out and actually come face to face with a child that's ill, you're not going to plan in your head how to approach it. You're just going to do it like whichever way you feel is the best.
Well, I disagree. I think that exposure, you can't obviously teach it from books, but I think exposure and doing placements in nurseries and stuff would be quite helpful, you know. Get a wide range of age groups that you would be able to, so we'll have a placement in a special school, but that will be a very limited experience, you know what I mean? Whereas if we had 2 weeks and then 2 weeks with a different age group and then another 2, yes, it would be skimming the surface, but at least it would be 3 different ranging experiences rather than one.
Like you say, in our special needs place, we have like a reflection day halfway through, she said today, and like that can kind of give us the opportunity to come back and we'll talk about the different ways that we've interacted with them and how we've used play and stuff. But I think maybe like in the prep week there should be almost like a give us ideas of how to do that kind of thing, to give us like, a base point where to jump off of, because some people who haven't had that opportunity to do that, they kind of need that little bit of a push, and like I think even people who have played with children with special needs, they still need that kind of, okay, I've given you a little bit of confidence, a little bit of idea, so you've got those ideas to hand when you go into placement.
They need some guidance. Some people I've met have just come out of school and have no experience, so they need the guidance to get on there. So a lot of people, they are really scared about placement because they don't know how going to go. Maybe we need a bit of just guidance.
And to be safe as well, because children with autism, if they get frustrated, they get very often they get violent, they start kicking, you know, and hitting you. So I'm sure they want to understand the schools where, you know, there would be danger of that, but just to be inducted, these reactions are not because you caused these emotions in a person, but because, you know, that it just became a bit too overwhelming, you know. Bits like that. I don't know whether they're going to do any kind of induction in the schools themselves. But
In the school?
I don't know, but it would be nice to at least get a
always
few
like a week
days of
before or
lectures.
something, like kind of just go around the class, like introduce them, like and introduce what kind of needs they have, that kind of thing would be quite good to give us a couple of days on us to get prepared for
Or
it.
like even if we have reps like we had from hospitals, they weren't particularly helpful, I didn't find. But you know, if that one person from all the schools would come and say, look, we specialize in this and that, and if you have a placement with us, you'll have these goals.
Or the types of schools, so if it's a specialist autistic school or something like that kind of thing might be quite good. I suppose once we get our placements, we can find out where they are and have a chat with someone on the phone, maybe, I suppose.
I don't know with the play aspect, like whether it can be taught, especially not with special needs, because it's like they all have
So it's specific,
there's such different needs. I worked in a school last week where there were just 6 children in the class, and lots of them were aggressive. I started and they were like, watch out for him because he's got him for him, and like just trying to attack him all day. But with some of the kids, it was like one of the boys always played with, they had like a tray with rice in it, and so he just pours it in his hand, and so it was like I knew that I could interact with him. It was like, will he let me in first of all? But then it was like I picked it up and poured it in his hand, and he sort of, and that was him playing, although it wasn't, didn't really seem like playing, but it's like,
But
unless I'd gone there, nobody could
because
teach
you
me.
have that. Well, I think it comes with the experience. You know, you probably kind of figured it out because you have had that experience. For somebody who has not been around children like that, it is quite intimidating because you don't know, you know, which end to start, you know, what to do. It is quite. We had patients who were had severe mental health issues and really sort of severe mental learning disabilities. And they can hit you or kick you out of the blue without you doing anything. So you become standoffish and you really don't know what to expect, and it kind of sort of then interferes with your willingness to help and engage. So we had, then later on somebody came from a specialist unit and actually explained how to handle that, you know, how to see the first signs of distress, and that made it much more manageable.
I think the important thing is like to have that kind of guidance as soon as possible, because if you don't, then you go almost, you either let it get out of hand or you have to learn it yourself, and it's so stressful having to try and learn to deal with a child that you don't know how to deal with. It's so stressful that you kind of, it just almost like fries your brain a little bit, I think. When I was younger, me and my sister were babysat by a woman with 2 children, and the younger boy has autism, and he a really nice child and everything, and like you didn't, like when I was probably 8 or 9, like you don't realise that there's something not normal with another child or anything like that, and then you start to realise when you're a bit older that that was the reason, but like you kind of just learn to deal with the way that they are, and you think, oh, they're doing that's a bit funny, like kind of thing, but you just learn to deal with it in your own way. But because you're aware of there's something being wrong, now it kind of is a bit like, oh well, what do I do? And you kind of get a bit scared, so having that guidance I think is really important.
Is there any particular skills you would think you should be taught within the nursing course around play?
I think personal care for children, like toileting and things. Some people might have never toileted children. Maybe they should have some like help on how to do it. Some children won't sit on potties, and if they're toilet trained like nappies, some children don't like potties, they want a toilet. So maybe play could come into that, just so they're not frightened of certain things. If some children don't like toilets, they scare them. They're like they want a potty. I don't know if that's something.
I think being taught how to interact, like just basic, but this is a really obvious one, but obviously making eye contact and bending down to the same level, so that's really obvious, but some people might not think of that. Or like you have to be tactile or not tactile or stuff like that. It's more a generalised set of rules, but it's just something to keep in mind. Like,
I think it's making people more comfortable with that being what you should do.
Exactly.
Like, they might feel a bit stupid, like bending down or whatever.
Yeah,
but like
knowing you should
having that kind of thing and seeing that that's what why it should
I haven't
happen.
had any experience at all with children. Obviously, I know like I have kind of like played with children before, but having that set of rules in my back of my mind probably make me more confident to then go ahead and
Also, say somebody who has got side problems. How do you interact with a kid like that? I've never looked after anyone who had
or deaf children or something like that.
you know, so just condition-specific
Yeah.
skills that would be useful.
Maybe there must be certain games. I looked after a blind girl before, and she was quite aggressive, so it was a bit difficult. But you had to be very tactile with her, and she really enjoyed climbing and stuff like that. So I'd take her to the park and just push her on the swing, and she loved it. But it's like maybe I don't know. Yeah, maybe there are specific things that I could have been doing, like I don't know, with feathers or things that she could have. I don't know, like she might have enjoyed doing.
Like sensory things. I think maybe some sign language, maybe something like that. Just basic kind of hello, my name is, that kind of thing might be quite nice.
Learn some sort of a language in school.
Yeah, they mentioned learning marathon.
Yeah.
Oh right, yeah.
Children's.
Oh, that's cool. I didn't know that.
I think no, they don't teach it, but it's like widely used.
It's widely used, so you might learn little bits or something like that.
When you go to a special needs school, they'll probably do like a morning song, and it'll all be a Makaton, so you'll just like learn it.
That's really good.
I don't really know about specific play skills.
I think just ideas and certain equipment that you can use for things, and like you said, like manual things like Play-Doh, sand, and I was at like a summer session with one of the children I was with, and this one boy that was there, he just loved the shaving foam, like no end, and it went everywhere. It was like the other side of the they were outside, but it was on the other side of the playground by the end of the day. It was literally everywhere. But he was just like loving this stuff, and like I wouldn't have thought of that ever. Like just like certain equipment you can use.
So like ways to make games out of the equipment that you have within a hospital without needing to.
Or even maybe without any equipment. So if someone's in a side room and they can't have stuff that's brought in that other children have touched and stuff, making games out of nothing, or like imagination games, like you said, imagination games, things like that, that would be quite cool to learn
Especially
about.
if there's like a thing with like infection control and they can't play with the toys that are there.
Yeah.
I think we've got to think about we're not just going to be working with just children, babies as well, about how we're going to interact with babies. In different ways.
Also, I was really surprised that we will not be taught restraining techniques because children get violent towards other children, autistic children get really vicious, and we will not be taught how to manage that, if you pull their arm the wrong way, you might just, you might cause more harm than good. And I was really sort of saddened that they won't tell us how to handle them.
There's kind of things like that, and like the whole you're not allowed to touch the child, but like hugging, things like that. That kind of there's not specific rules that you can and can't do. Like some like autistic children, some children with special needs, learning difficulties, they're very very tactile, and they come and sit on you and things like that, and you're like, there's no particular rules, but you're not doing anything wrong, but someone else might see that and think that it's this and this and this. But if you have a set of rules in your head that you go by, then that's a good idea, but we haven't been taught any of that.
Yeah, I think there is rules, but we've just not been told them. Yeah. But maybe there's something down to the school's policy.
Yeah, and they'll teach us at the start, something like that, maybe.
because then maybe Great Ormond Street would have a different policy, guys as a Thomas, it would be very different places.
I think every setting has different policies and procedures that you have to follow.
The whole safeguarding thing is like a universal thing, but like the specifics of
Yeah.
some things and what you can and can't do, I think that is different. I think this kind of highlights the fact that there's a lot of things that we haven't been told, and we're going, it's been like 4 weeks, and like, oh no.
It's early days, yeah.
Yeah, no, it's
You can't
not.
learn everything before you
Yeah.
go. It's just not enough time.
I think it's definitely a good idea to learn about things like that, and like having a little bit here and there, like maybe in theory as a children's lesson, to kind of have their like one session about play and things like that, because that's I think it's quite a big part of children's nursing. Maybe not so much the older children, teenagers, but you still have to learn how to interact with them. But I think
Well, we'll
that-
have communications in the new year, won't we? The whole day of communication. Communication. I think it starts in January. No.
There must be a way to communicate like through play as well with children that you can't actually communicate with verbally. Whether there's a way that they could sort of teach you how to, I don't know. Makes sense.
I'm just quite wary as well, you know, most cases the children won't be alone in the hospital, there will be parents, and you want to be friendly but you kind of don't want to take over too much, and I know how to be subtle about that, you know. So that's the other aspect I'm a bit...
That's what I found hard, being in people's houses and like the parents right there, but I'm playing with their kids while they're making dinner or something. It's quite hard, that kind of, I don't really want to take over right now, but it's quite nice that I'm doing that kind of thing. I remember at one point, another one of the carers was having an assessment with the child upstairs and the team leader, and I was downstairs with the other two children, so I was just there because this shifts got overlapped. So I was there with the other two children, and they started arguing over this board game thing. It was just like, okay, just calm down, and we'll swap in a minute and we'll do this, and like that kind of calming them down and talking and that kind of thing. Because I knew them, it kind of made it easier to sort them out and play on separate things and interact with them at the same time. I think that's kind of a thing to like learn, is like, or even be introduced to, is that if you've got two children that want to play things, you can play with both of them. I think that's quite important. So.
Or even, you know, if somebody's 5 and they say, go away, I don't like you, you know, do you actually go away and leave them be? If they are safe, or do you try and change their mind, you know, I'm a nice person, you know, what do you do in situations like that?
I think some children will come in with a social worker and have no parents, so you will be that structure.
Even be introduced to that kind of situation, or like that process of being a child being in hospital with a social worker or parent.
Anybody want to say any final thing? Anybody got anything burning that they want to say about anything that we've sort of talked about? No? Everyone happy? Right, we should stop recording.